Good afternoon, everyone. I'm glad you could attend this educational seminar about major depressive disorder, commonly abbreviated as MDD. So, my name is Ahilon-Mendoza. I'm a licensed physician psychiatrist at the Atrium Health Floyd Clinic in Rome. I specialize in addiction and mental health disorders in both inpatient and outpatient care, specifically to the Northwest Georgia adult residents. On your seat was a name tag. Please put on your name tag so that I can associate a name with a face so that we're not strangers. Making sure that everyone has their name tag. Okay, a little about myself. I am a first generation Latinx college graduate, and my most recent education was at the Emory School of Medicine, where I went to medical school and did my residency at Atrium Health here in Rome. Uh, Before I went to medical school, I actually studied at Georgia State University, getting a master's in nutrition, a master's in public health with a concentration in nutrition through their coordinated program because I wanted to sit for the RDN, but I chose to do an MD instead. Before that, I studied here locally at Georgia Highlands College. I was a health science major. I had gotten my bachelor's in the end of 2024, and I've gotten my associate's of biology at the end of 2022. Why am I here, you may ask? At a college campus filled with healthy and adventurous students, why is the medical doctor here? In my field of work, I have noticed an increased rate of admitting college-age students around 18 to 20 years old coming with extreme cases of major depressive disorder, also known as MDD, um, who require clinical intervention for overwhelming feelings of self-harm or a pessimistic mood interfering with their daily life. So, I want to ask a very personal question, but please do not answer this question. Has anyone in the room felt helpless, worthless, or even suicidal during a life-changing phase of continuing their education? While dealing with everyday problems associated with life and work, do you feel like it has become too much to deal with? While contemplating your answers, please reach down under your seats and write your responses down on the index cards provided under your seats with the Sharpies provided. Okay, so once you're done with that, we were going to do an icebreaker, which would basically be I have in the center of this circle around here with us, with your response, I was gonna make the participants go to the center of the circle, grab an Amazon stuffed plushie that has like a mood response that most people use in therapy. With their index card, they were gonna stuff it in the shirt of the doll, and to the person on their left, they were going to tell them, hey, this is my name, this is my major, this is what I'm studying. And if they felt comfortable, tell them why they had chosen the doll specifically, because it would exhibit a specific emotion during this icebreaker, just to get everyone familiar with one another. Okay, so to begin with my presentation over major depressive disorder, um, at the at the bottom here on my notes, I have a link to my quizzes. No. Okay, I'm sorry. Okay. Um, so that was the icebreaker directions. I'm gonna go over right now over my PowerPoint. This is my PowerPoint over major depressive disorder, or commonly abbreviated as MDD. It is presented by me, Ahilon-Mendoza. I'm part of the Department of Behavioral Health there at Atrium Health, and I do have my master's, and I am a medical doctor. So I have MD and MPH for my credentials. Okay, let's get started with our present. Okay, let's get started with our presentation about MDD, Major Depressive Disorder Awareness. So, my goals and objectives of this presentation is goal number 1, to increase knowledge of major depressive disorder among college students here at Georgia Highlands College. Goal number 2 is to decrease the stigma surrounding major depressive disorder among college students here at Georgia Highlands. I have main 3 primary objectives. Number 1, by the end of the lesson, at least 50% of participants will recall one mindfulness exercise, tool recommended for practice in depressed individuals to influence their self-talk, or otherwise known as their head voice, for an optimistic mindset. Objective number 2 is by at least at the end of the lesson, 70% of participants can define major depressive disorder accurately in their own words. Objective number 3, at the end of the lesson, at least 20% of participants will evaluate their mental health state to see the likeliness of depression from recorded responses in the patient health questionnaire of moderate to severe symptoms. Major depressive disorder in everyday life. Everyone responds differently to major depressive disorder, and it can vary in a wide range of emotions that look unique in each person, from children to teens, specifically to adults. Behavioral and physical symptoms are not limited to, but mostly include no longer going out, not being able to concentrate at work or school, no longer doing hobbies and extracurriculars they once enjoyed, changes in their eating habits, like eating too much or very too little, um, which can, ultimately lead to fast weight gain or a lot weight loss severely. Insomnia, which is difficulty sleeping, or hypersomnia, which is sleeping too much. They're either trying to avoid by sleeping, and having a strong sense of fatigue, persistent feelings of tiredness. The feelings and ideas commonly found in MDD patients is they're indecisive. What do they want? They're irritable, primarily in children. They're heavily disappointed in thoughts of that I'm a failure, or that they have ideas that they're worthless. And their emotions are overall in a miserable state. They tend to blame their MDD diagnosis like it's my own fault. Being alive is no longer worth it, and people will be happier with me gone. These are the common ideas in a patient suffering from MDD. So, what is the definition of major depressive disorder in a clinical setting? The Cleveland Clinic defines it as a mood disorder that causes a persistent feeling of sadness and a loss of interest in things and activities you once enjoyed. How do healthcare professionals like myself differ in depressed feelings versus depression? So, like how you feel kind of depressed versus a clinical diagnosis of depression. Well, it is to be evaluated to be depression only if the symptoms and feelings are experienced daily for 2 weeks continuously. That's an important note. Experienced daily for 2 weeks continuously. There are several different types of depression, but major depressive disorder, aka MDD, is also known as clinical depression, is the most common and considered by clinical professionals to be the most severe type of depression. The diagnosis of depression is made by healthcare professionals, i.e., primary care physicians, and mental health professionals like psychiatrists and psychologists, who can view your symptoms, medical history, and prior mental health history, ruling out underlying chronic conditions for mood imbalances while assessing the context of your systems to define specific depression you may be experiencing. Now, I highlighted the point of ruling out underlying chronic conditions because if your mental health is in a poor state, your physical health may reflect a poor state as well. And here's an infographic of the overall 6 major types of depression: major depressive disorder, perinatal depression, which occurs before and after childbirth, also known as postpartum depression, premenstrual dysphoric depression disorder, severe depression, anxiety, irritability before menstruation, persistent depressive disorder that occurs for most of the day but not all day, seasonal affective disorder, also known as SADS, is typically onset by a season change, and atypical depression, which is diagnosed by MDDs and includes mood reactivity. Atypical depression is very rare, but it does occur. Common reasons for MDD. These are the general reasons to explain why a patient may have gotten MDD diagnosis. The American Psychiatric Association highlights three main categories that are common for risk factors for MDD. Biomechanical or your environmental factors are a social history of substance abuse and alcoholism, so like drug dependency in a family scenario, social history of substance abuse and alcoholism, stress triggers like financial issues, marriage, or education issues, which can cause the hormone cortisol to affect the neurotransmitter serotonin and lead to depression. When you're stressed out, your body basically goes into survival mode. And when it gets triggered to be like, oh my goodness, I don't know what to do anymore, the hormone cortisol can cause a huge hormonal imbalance to cause severe emotions that feel like depression. It could also be a genetic predisposition from your family history of depression, from your maternal and paternal parents, your grandparents. It's estimated to be around 40% of the time genetics determines whether or not someone will become depressed in the future. Also, your personality could be a huge factor. If you have a negative mindset, usually falling under a pessimistic mindset, you could increase your chances of getting depression, and have an introverted personality, which causes you to be not a really a people's person, but rather to your own self. And this social isolation could trigger effects of you not seeking help or not seeking the social support that most of us need, which can trigger feelings of isolation and, feelings of negative mindset to cause you to further escalate your depression to a higher risk. Okay, differential diagnosis or explanations from a doctor. It could also come from reasons of medications or substance abuse. I've explained a little bit about alcoholism, but specifically steroids, antihypertensives, antibiotics, sedatives, alcohol, stimulant withdrawal. So, like a caffeine crash or a sugar crash, or even when you're going out without your cigarettes, you may experience withdrawal symptoms, which can trigger a response to your body to go into a panic mode, which can cause common feelings associated with depression and anxiety. Nutritional deficiencies such as vitamin D, B12, B6 deficiency, and iron deficiency. This, added with social isolation and improper nutrition, could cause mixed signals, which why is I highlighted it, to your brain for inactive mode, which basically makes you feel like you're not going out much, you have an unhealthy diet, your physical health is declining, and so this direct relationship with your physical health will reflect your mental health also deteriorating. And this figure right here basically explains it by biological and social, psychosocial, and cultural factors may trigger MDD, but MDs, your doctor, would basically clinical management will include nutritional intervention. So we have to talk specifically about your diet. Um, Unhealthy dietary habits, could primarily lead to unhealthy lifestyle and chronic comorbidities with on top of your depression, which can cause a pyelotropic effect, such as inflammatory responses, MGB axis, HPA axis, neurotransmission, which could, uh, under cause serotonin and selective serotonin responses in the brain because that you already have a bad diet and you have a poor health. Another reason could be neurological causes such as cerebrovascular accidents, epilepsy, Parkinson's disease, Alzheimer's disease, which is from brain trauma, diabetes, thyroid disorders, adrenal disorders, which explains your fatigue, metabolic disturbances such as hypercalcemia, hypernatremia. Body is not in your homeostasis health, it's not in the best health, which could cause your foul or negative mood. So, college students, the rising mental health crisis overview part one. In the United States, physical health care continues to be a significant issue for working class Americans who are either number one, uninsured or overwhelmed with the legal complexity of health insurance. National insurance for medical coverage is hopeful wish in the United States compared to other developed nations like the United Kingdom, France, and Canada, which have shown some national sponsored governmental health care support for their citizens who are not only fighting COVID-19, but also the rise in mental health disorders in their demographics. The controversial idea of national health care for Americans has been debated among financial analysts, legislators, political leaders, and college students